Cigarette use among teens continues to drop, but a new study published in the Journal of Pediatrics warns that e-cigs are on the rise.
CBS News medical contributor Dr. Holly Phillips is here to tell us about the findings. Holly, thanks for being with us.
Of course, Elaine.
What did this study find?
Right. Well, this study, it was a small survey done by researchers at the University of Southern California, and it looked at 11th and 12th graders in the area. And they really focused on what role social acceptance and approval from the kids' friends played in e-cigarette use. And what they found was that it was even more important to teens that their friends approved of their e-cigarette use, even more so than regular cigarettes. So 91% of the kids who used e-cigarettes said they felt that their friends would approve of the habit. But also, these are some really interesting numbers. In terms of e-cigarettes, if their friends approved, it increased the likelihood that they would use them by 37 times.
Wow.
Whereas with regular cigarettes, even if their friends approved, it only increased the likelihood they would use them by 9 times. So those are some really striking numbers.
Yeah, and so is this doing or undoing all the progress that's been made to prevent teens from picking up a cigarette in the first place?
Vlad, that's the million-dollar question, and that's actually why so much research like this is being done. So for a number of years now, it's been great news in terms of smoking, right? The entire population is smoking less, and specifically young people are starting later and smoking less in terms of regular cigarettes. But now the question is are e-cigarettes going to undo this? They seem very kid-friendly. You know, they're colorful. They've got these flavors like bubblegum and watermelon. And it turns out, in this particular survey, 40% of kids who had used e-cigarettes had never smoked a regular cigarette. So they're turning to these first. The question is that going to lead to smoking regular cigarettes as well?
And what about the long-term health implications here of e-cigarettes?
Right. They're sort of marketed as not being as dangerous as regular cigarettes.
They certainly are marketed like that. And in fact, in many ways, that's fair to say, right? You know, a lot of the damage that comes from regular cigarettes comes from burning tobacco, which results in tar and thousands of chemicals. We know that's bad for our heart, for our lungs, for our entire vascular system. You don't get that with e-cigarettes, but you're not exactly home free. Nicotine is still an addictive substance. We don't know what it does long-term to kids. And there are other chemicals. One is called diethylene glycol, and it's found in antifreeze. So what you're breathing in e-cigarettes isn't quite as good as fresh air, let's put it that way. And so, you know, we're still reticent to see kids start early.
Fascinating study. Dr. Holly Phillips, thank you so much.
Great to be here.